Hello. I'm John Davison and I'm Chief Executive of Supportive. We're a not-for-profit charitable trust based in County Durham. We provide care services and ambulance services with a special volunteer driver service to add on to our team. We've been operational now for 30 years, so we're well established, and we have a team of nearly 300 people with our volunteers and staff. We look after people in the care side. We take people from emergency response from hospital where they don't have a care package, and we look after them until they can be looked after by a care team. We have 140 carers who particularly go around and will look after people maybe 4 times a day. Our care is getting much more technical now, so rather than just maybe making them a meal and just looking after some of the basic needs, we're doing a lot more care which is very, very complex and requires a high skilled team. To that we put in an ambulance service in 2016. We started off with 2 little ambulances, and we've developed that into having a fleet of 24 ambulances, and our ambulance team go right across the country. We do a lot of work for the North East Ambulance Service, and with that we look after a lot of dialysis patients. So you'll see our teams out from 6 in the morning till midnight, 6 days a week, looking after the dialysis teams. We could equally be going to maybe taking a child to Alderhair Hospital in Liverpool, or we go down to Cambridge, the Heart Hospital. It's amazing how many people get transported about. I suppose one of the core of our organisation is our volunteers, and when we first started we had about 5 or 6 volunteers. 30 years ago we have over 90 volunteer car drivers, and they can use their own vehicles and take people to hospital, for hospital appointments, GP appointments, and we also do a lot of work looked after children, where we're supporting them with transport to and from school and to special visits. And we work with the NHS and local authorities. The challenges that Supportive have faced over its operational life are quite a lot, really. We work on really fine margins. Being a not-for-profit organisation, our main asset are our people, and we have to look after our staff and make sure they've got the right safety equipment, etc. We did get a large contract a few years ago from the NHS, and through a large number, 14 GP practices within County Durham, to go into people's houses and homes to try and prevent accidents and falls. And to that extent, this is where we needed a system to record our data and make sure that we were able to tie up the hospital and GP data with information that we were collecting. To that point we got in touch with Excelpoint, and Ian Brown, the Chief Executive of Excelpoint, is one of our trustees, which helped us with our contact details. And Excelpoint were able to produce a new system so we could record data for individuals very quickly. So it was, we didn't have to spend too long working out how it was going to operate. It meant that we were able to start quite a large contract within a 2-month turnaround. So it was brilliant, and we were adding fields to our system, information, as we went along as well. So that the team at Excelpoint were great at backing my team up. And we used that system for about 4 years until the NHS ran out of funds. And it was a shame, really, because we did prevent a considerable number of people going to hospital. We made appointments for people to go to opticians, hearing appointments, back to the GP or hospital appointments, and we put in infrastructure in their houses to make sure that they weren't going to fall. So Excelpoint made a really good part in delivering a high quality system. The benefits to Supportive of putting in the Excelpoint system was that it helped us with our promotion of our services, the standing in the community, and enabled us to gain new contracts in the future. So it was a pivotal moment within the life of Supportive. So it really made a difference, and we were able to be trusted by a large number of GP practices, and that led on to other contracts and the development of our ambulance service. So yes, it's been a very good partnership, and we look to go from strength to strength over the next 30 years. So going through the process of developing this the system with Excelpoint, we've learned quite a lot actually, and it helped us with other areas of our development. I think one of the key areas is that you must put in a good team initially and make sure you've got a really effective project plan. And we work really well with Excelpoint's team. At first, perhaps at Supportive, we perhaps didn't have the right people who had the right technical knowledge. Now, we obviously use you to provide that technical knowledge, but you certainly need to have somebody with a bit of IT understanding to get the best out of the process. And if I was putting a new system in at the minute, I would look carefully about working through the process as well effectively and slowly as possible initially, to make sure that your team, your organisation understands why you're putting in a new system and what are the benefits of that system. I think that's what we've learned, and I think that goes with any system that you would put in process, that it might sound a good idea, but you need to ensure that it was implemented effectively.